Welcome back to Nursing Research Tips, where we turn what sounds intimidating into something totally doable. I'm Jenny Barrow, and in today's episode, we're taking on a term that strikes fear into the hearts of many a nursing student: theoretical frameworks. What are they? Do I really need one? And what's the difference between a theory, a model, and a framework anyway? Whether you're reading nursing research, planning a quality project, or just trying to understand how evidence fits together, this episode will help you make sense of it all without the headache. So let's start with the big idea. A theoretical framework is like a roadmap or a blueprint that helps you organize your thinking. It provides a lens through which you can clearly view a problem, design a study, or guide a project. So it gives your work direction and purpose. In research, frameworks explain why something might happen and clarify how different variables or concepts are expected to connect. For example, if you're studying how patient anxiety affects recovery times after surgery, a framework might help you understand whether anxiety influences recovery directly, or if there are other factors like social support that mediate that relationship. In nursing practice, frameworks do not just stay in textbooks. They actively guide decision-making, and they help nurses evaluate care outcomes. Take, for example, the health belief model. This framework helps nurses understand why a patient might or might not follow through on treatment plans based on their beliefs about illness severity and their barriers they expect to experience in their care. Think of trying to build a house without a blueprint. You might still end up with walls and a roof, but the structure could be very unstable or inefficient. Without a theoretical framework in research or in practice, you risk making decisions or jumping to conclusions that don't hold up under scrutiny. Your findings might be confusing or even misleading. So yes, understanding and applying a theoretical framework is critical. It brings clarity, guides your questions, supports your methods, and ultimately strengthens the impact of your work. Okay, here's where things can get a little fuzzy. What exactly is the difference between a framework, a theory, and a model? Let's clear that up, because understanding these distinctions really does help you use them effectively. So first, a theory is a set of concepts and propositions that aim to explain why something happens. It's like a detailed story or an explanation. For example, Florence Nightingale's early environmental theory explained how environmental factors like cleanliness and the amount of light influence patients' health. Theories often answer the why questions in research or practice. A model is a simplified, often visual or practical representation of a theory or a concept. Think of it as a map or a diagram that shows the relationships between parts. For example, the health promotion model by Nola Pinder visually outlines factors that influence health behaviors, which makes it easier to apply that theory in everyday nursing practice. Finally, a framework is a broader structure. It's usually based on one or more theories or models, and it helps you organize a study or a project. It acts as scaffolding that supports your research questions. It guides data collection, and it shapes analysis. For example, a theoretical framework in a study on patient adherence to medications might integrate the health belief model and the social cognitive theory together to comprehensively approach behavior changes. Think of it this way. The theory is the deep explanation behind why things happened. A model is a roadmap or a diagram that shows how pieces fit together, and the framework is the scaffolding or the structure that you hang your work on to keep everything aligned and strong. In nursing, you'll come across various types: conceptual frameworks that define abstract ideas, theoretical frameworks that ground research in existing theory, logic models that visually map inputs, processes, and outcomes, and implementation frameworks that guide putting evidence into practice. To bring this closer to home, as a nurse educator teaching adult nursing students, like myself, you might use Knoll's theory of adult learning, or andragogy, as your guiding theory. This theory explains why adult learners engage best when they see relevance, when they can draw on life experiences, and when they take responsibility for their own learning. You might use a model that visually breaks down these principles into teachable components, like readiness to learn or motivation. When you build your curriculum or develop teaching strategies, you're essentially creating a framework that organizes these ideas, making sure your lessons connect theory with practice, that they support student engagement, and that they evaluate learning outcomes effectively. For example, a specific teaching strategy rooted in andragogy is the use of case-based learning. By presenting real-world patient scenarios that students can relate to or that they have encountered, you tap into their prior experiences and promote active problem solving. This approach helps adult learners see the immediate relevance of the content. It increases their motivation to learn and encourages them to take responsibility for applying knowledge, exactly what Knoll's theory emphasized. So Knoll's theory provides a deep explanation. A learning model lays out how those concepts would interact, and your teaching framework, how you structure your class, holds it all together to guide your work as an educator. All of these tools help you think clearly, plan effectively, and evaluate meaningfully, whether you're conducting research, designing a program, or delivering patient care. Let's make all of this more practical. Here are a few familiar frameworks you might have seen in nursing textbooks, research studies, or in clinical projects, along with how they're typically applied. First is Orum's self-care deficit theory. This theory is often used in patient education and in rehabilitation research. It focuses on patients' ability to care for themselves and identifies where deficits exist that nurses can help address. For example, a study might use Orum's theory to design an educational intervention for diabetic patients to improve their daily glucose monitoring and foot care routines. All of this is meant to help them regain independence and prevent complications. Secondly, let's talk about Pender's health promotion model. This model is great for projects focused on behavior changes and wellness or health promotion. It looks at factors influencing health behaviors like perceived benefits, barriers, and self-efficacy. For instance, a nursing project aiming to increase physical activity among older adults might use Pender's model to tailor interventions that address motivational factors and social support. The Iowa model of evidence-based practice is widely used for implementing EBP in clinical settings. This model guides nurses through identifying triggers for change, reviewing evidence, piloting interventions, and evaluating outcomes. A hospital unit that is seeking to reduce catheter-associated infections could follow the Iowa model to systematically adopt and evaluate a new catheter care protocol. If you have much practice experience in the world of quality improvement, you've probably heard of Donna Bedian's structure, process, outcome model. This classic model is often used in QI projects. It breaks down healthcare quality into three components: structure, which is resources and environment; process, which is the process of care delivery; and outcomes or results. For example, a quality improvement initiative might examine how nurse staffing levels, structure, affect medication administration errors, process, and patient safety outcomes. A final example is the example of social determinants of health, which is a framework. Increasingly important in health equity and public health work, this framework helps nurses consider how social, economic, and environmental factors like income, education, and housing impact health. A community health project addressing childhood asthma might use this framework to incorporate housing quality and neighborhood pollution data into their intervention planning. Notice how each framework helps you focus your approach. Instead of just winging it, you're working within a structure that has been tested, refined, and shared widely in nursing and other healthcare disciplines. This not only strengthens your project's foundation, but it also improves communication with colleagues and with stakeholders who would recognize those familiar frameworks. Now, of course, there's no way I could go over every possible framework theory that you could possibly use. This was just a non-exhaustive list. But one thing remains clear. Using a framework makes it easier to identify gaps, design meaningful interventions, and measure success because you have clear concepts and relationships from that framework that are guiding your work. Here are a few quick tips for selecting the right framework for your project or your paper, because picking the right one really can shape your success. First, start with your purpose. Clarify what you're doing. Are you conducting original research, implementing evidence-based practice, or leading a QI initiative? For example, if you're evaluating a clinical intervention's effectiveness, then a theoretical framework that explains behavior change might be a really good fit. But if you're working on a QI project, a model like Donabedian's structure process outcome might guide your evaluation approach. Secondly, identify your key concepts. What exactly are you trying to influence, measure, or understand? Are you focusing on patient adherence, nurse decision-making, or health equity? For instance, if your project aims to improve medication administration adherence among older adults, frameworks that address health beliefs or social support could be helpful to consider. A third tip is to look for alignment. Search for frameworks that have been used in similar settings or with similar populations. For example, if you're studying chronic disease management in rural health clinics, see what frameworks other researchers in that area have used. This is not only important for ensuring relevance, but it also helps you justify your choice to reviewers or to stakeholders. Literature reviews and published research studies are excellent places to start. Also, it's important to keep it simple, especially if you're new to a theory. Avoid overly complex frameworks or those that are loaded with jargon that you don't need. A straightforward, well-established framework can provide clarity without overwhelming your work. And here's a tip you don't want to miss. Don't hesitate to ask for help. And I mean really leverage your resources. Research librarians are experts at digging through databases and guiding you to the most relevant theoretical frameworks and models for your selected topic. They can help you perform targeted searches using the right keywords and subject headings, saving you hours and days of frustration. When you meet with a librarian, here are just a few example questions that you might ask to get the best assistance. First, can you help me find theoretical frameworks or models commonly used in your area of research? Or what databases or search terms would you recommend for locating nursing conceptual frameworks? Or do you have access to resources or guides on selecting appropriate frameworks for EBP or quality improvement projects? Or, can you show me how to use subject headings or filters to narrow my search to relevant theories or models? In addition, your research mentors or faculty advisors can also offer valuable insight based on their experience with similar products. And if you want a quick starting point, even AI tools like ChatGPT can help you brainstorm potential frameworks based on your project description. However, quick word of warning, AI is a tool to complement, not to replace the expert guidance of librarians and mentors. This work that you're working on, whether it's for academia or whether it's for research proposal, should be your own. If you are doing work affiliated with an academic setting, make sure you follow the academic integrity policies of whatever university or setting that you are affiliated with. Using these strategies will help you find a framework that fits your project like a glove, setting a solid foundation for your research, practice, or quality improvement efforts. So to wrap things up, frameworks are not just academic fluff. They are the glue that holds your ideas together, and they help you build something that makes sense. So here's your reflection prompt for the week. What is a clinical problem or question that you are curious about right now? And what kind of framework might help you think about it more clearly? Next week, we're going to dive into a relevant topic for nurses across all settings and specialties. What makes a good research question? I'm going to walk you through the PICO or PIO formatting and how to avoid the most common pitfalls that students typically fall into. Until then, thanks for tuning into Nursing Research Tips. If you learned something new, share this episode with a colleague or leave a review. I'm Jenny Barrow. I'll see you next time.